Oh.
No, it's all protected and it's fine. Yep. Yep,
If you go to your ophthalmologist every 2 years, like they tell you to go.
right.
Do they check for dry eye syndrome or?
They look.
Oh, do
I
they
mean-
tell you they?
Well, I mean, you can look,
Okay.
but looking doesn't tell you a lot. If you're always severely dry and they put the dye in and you had staining, then you know, okay, there's a problem here. But I mean, unless you're complaining or they're really looking, but the salt level machine is inexpensive. And so there's a lot of doctors who have the salt machine that can measure the salinity of your tears. I've done, I don't know, I've probably done thousands of salinity tests. And the machine is good, it gives me information, but it is not as predictable as the lip of view. That lip of view pretty much measured it, boop, and then it's right on the button. The salt level tends to fluctuate some. So I mean, it could be a variety of factors. You did drink a bunch of water before you came in. The salt levels tend to fluctuate around a little bit, but there's a lot of the salt machines as far as measuring your sodium levels. But as of now, there may be 75 of the lip of view machines in the world, or 100. I mean, it's not a lot. So I know I just checked because I had a patient going to Michigan, and they're just interested in getting the treatment. And I searched on the company website, and there's none in the state of Michigan. So, I mean, there's only a few of these around, so they're hit and miss still yet. And the reason is, as we already discussed, it's a very expensive, and it's a non-covered treatment. It's tough, you know.
Is it effective in children?
If your lipid levels are low, then it should help. So that's the good thing about the machine is we measure ahead of time before we do any treatments. Because if your lipid layers are good, then we're not doing that machine. We're going to try other things.
The diagnostic machine you have, it differentiate all different problems.
It tells me what your oil is. So you have 3 layers to your tear. Right now we have nothing that measures the mucus layer. So we can measure the water layer by how salty it is or how hyperosmotic it is, and we can measure the lipid layer. And so we can measure those 2 layers and know which one is bad or worse, and that way we can design the treatment based on what the test shows. But we have nothing that will, other than there was an old machine that measured the lactoferrin, which is a protein that your eye produces, but that machine was never consistent enough, and that company went out of business.
If it's an infection, you do culture?
I almost never culture anybody's eye, because if someone has an eye infection, I have a microscope I'm looking at your eye with. We diagnose that without a culture. The only time I'd ever culture anybody is if we had a really bad ulcer or some kind of something really bad in your eye, then we would.
So one more question.
Yeah.
The lipid flow, you do under topical anesthesia?
Yes, just drops. Yep. There's nothing, I mean, I'm just laying there and it's very comfortable. There's nothing painful about it. Yeah, any other questions?
The bottom of one of your slides said no baby shampoo.
Okay, that's years ago, and for me until 6 or 7 months ago, people had blepharitis. You told them, okay, go back home and clean your lids off with baby shampoo and a Q-tip. But now, if you think about it, we really didn't know all this information now about the lipid layer and been able to measure it. What does soap do to lipid or oil? Dispersing. So by using baby shampoo, you just made your lipid layer get worse. So we don't use that anymore. I don't recommend. So we have a special antiseptic foam and pad in the office that has almost no soap in it versus the other ones that do. And it has an antiseptic in it that kills bacteria. So I tell people no more baby shampoo. Yeah?
Back to the comment about Walmart and the airflow in there. Does the fan in your bedroom or reading room?
Horrible.
And same thing, question on air conditioning in cars. Is that?
Got to turn the vents away from you, and you got to turn. If you read in your den or wherever, and the air conditioning vent's blowing in your direction, you got to move your chair. You got to do something. And if you have ceiling fans, you got to flip them in reverse. If you really want them on, then flip the button and have the air go the other way around. Because environment is a big factor in how your eyes feel. And the more when you're reading, you're gonna have to use tears more often because when you read, you stare. When you drive, you stare. When you watch TV, you look at a computer. All those things where you're concentrating on what you're doing, your blink rate decreases. And in fact, some people hardly ever blink all the way down, and we actually have a sheet that we give our patients when we see that of blinking exercises.
That's interesting.
Do you recommend those OcuSoft moisture pads?
But that OcuSoft that's in the drugstore has the soap in it. The OcuSoft that you can only get in the doctor's office, they took the soap out of it. And it only is an antiseptic. So the OcuSoft, the company that makes that, has two boxes. The box they sell in the drugstore and the box they sell through the doctor's office. Why?
It starts with an O.
It's OcuSoft. So that's at the drugstore, but it's a dark blue box and it's full of soap. It's great for taking makeup off, but it's not any good for your blepharitis.
Macular degeneration, how is that? Is that in any way related?
No, not related. So the macula is in the back of your retina, in the center of your vision is your macula. You can see your hand out here all day long, but you couldn't read one scintilla of anything of a book over here. You have to look directly at it. And so the macula is about 1.5 millimeters in size. It's small, but that's where all your clear reading vision is located. And so as we get older, those cells, because they're very specialized for whatever reason, degenerate over time. And so therefore it is your vision. And there's two types of macular degeneration, dry and wet. So dry is 85% of all macular degeneration is dry. And so the cells just slowly, like our skin changes over time, slowly degenerates over time. And usually your vision doesn't go away that fast, though it can get really bad at the end. Or you can have a blood vessel that's growing underneath your macula that bleeds into your retina, and that's the wet type. So the wet type is treatable with injections now. The dry type, again, we would go back to nutrition. So there's some evidence that fish oil may be beneficial in macular degeneration, and we also, by the same company makes the Hydro Eye, in the office we sell now a eye vitamin that has all the, like Centrum Silver, plus all the eye vitamins inside the one vitamin system. And so that's I take that as well because I don't want to get it. So.
I gotta get that.
Yep.
If you're using those hot compresses in the morning, like you say, that's
Right.
the best time to do it.
Yeah.
Do you recommend using the artificial tears before you do the compresses? Or
I don't think it matters.
Doesn't matter?
I don't think so.
Okay.
Yep.
I've been diagnosed with rosacea in the eye,
Yeah.
so I take diaxoline.
Yeah.
I don't do it regularly, but if I don't do it regularly.
You might try the Hydro Eye stuff and see if it works.
Okay.
Because it's anti-inflammatory, so that might be beneficial. I mean, there's not a study to show this thing. The Hydro Eye is taken off, and the company that makes it is now doing studies with arthritis and all kinds of things with this because the scientific studies have shown how well of an anti-inflammatory it really is, and so it's worth trying.
How expensive is it?
The Hydro Eye, I think it's like $31 for a month's supply. It's about $1 a day. It's 2 capsules in the morning and 2 at night. And the stuff we sell in the office, we mark it up about $5 or $6 from what it cost us, just for handling and stuff. So, because we had someone, you can actually, the Retain, it was the Retain MGD someone got at the drugstore once? I think it was.
Yeah.
So you can actually go to your pharmacist and say, please order me Retain MGD and I want to buy it from you. And we had a patient who did that.
Mm-hmm.
And we charged, I think, $17 for a box of 30 and the pharmacy charged them $28.
Mm-hmm.
So
They mark it up a lot.
So the things that I sell in my office, all these products, we have a marginal markup just for our expense and time and effort. We don't mark it up like the pharmacies and double. I mean, it may cost us $12 for a box, and we charge $17. Where if they pay $12 for it, they're going to charge $25 or $30 for it. Yep.
Do you have to be a patient in order to try some of the products?
No.
Or can people just come in and
Come in and try it. But I mean, the only thing I would tell you that is that the beauty of what we do now, and the doctors who have developed, and we sort of talk to each other, and we've given presentations as a panel to other eye doctors. And, you know, we keep in communication, so we sort of find out how things do, but you really, we've taken a lot of the guesswork out of it, because now you're sort of, try this, try that, this brand, I'm gonna try Sustain this week, and then I try Optive the next week, and I'm doing all these things, when you can really be more specific about, this is exactly what I got, and this product is the right one, it makes sense for what tests show I have a problem. So it really, there's no harm in doing it, you can buy it, and I think probably Hydro Eye is probably good no matter what kind of dry eye you got, because of just what it does. But anyway, that's, you know, but you're happy to come in and try the products, yes. Yep.
I'm leaving the end of April. Is that enough time to get into your office to give me
Sure.
the
We're there this Friday.
Yep. Any other questions about it? Okay?
This pill
Yep.
that you take, what is that, omega-3?
Omega-6.
6, okay, does that have, you said centered silver and everything? in
No,
it?
that's a different one. That's the macular degeneration. So that is for dry eyes, the other is for macular degeneration. So I do this only for when I speak here at the church. We have coupons for anyone who's never been at my office for a free evaluation, if someone wants one. We also have a whole packet of a lot of what I just discussed. It gives you all kinds of stuff about dry eyes, about the LipiFlow treatment, all the different options